Good morning, everybody. I'm Dr. Linda Thomas-Hemak, President and CEO of the Wright Centers for Community Health and Graduate Medical Education. Please accept my sincere apology for not being with you today and able to attend the Institute's Indicators Forum in person this year. The importance of the annual Indicators Forum and all of the crucial work being done by the Institute to benefit the health and welfare of our regional community cannot be overstated as we work together to turn information into insight, to inspire and organize our efforts to benefit the citizens of Northeast Pennsylvania. Today is a day to celebrate our successes and acknowledge our progress we made as a region, in no small part because of the Institute's fine efforts. Thank you especially to Terry Ohms for gathering us all as inclusive stakeholders vested in the health and welfare of our regional community so that we can reflect on and bring the current status and opportunities of our regional home and workplaces into perspective as we gain a better understanding of our enormous strengths but also our shortcomings as a region. The Institute's passionate and tireless work is greatly appreciated by those of us who value an outcomes lens when celebrating successes and also evaluating public service deficiencies to design responsive solutions, having great faith we can improve what we can measure by organizing intentional, mutually reinforcing action strategies around clarified, shared metrics of our success. Without reliable data we trust, we fly blind, often in fragmented silos, and we fail to make big improvements that can solve complex, shared debacles facing and challenging our community. With data illuminating the North Star of our shared prosperity, we can do wonders together and actualize the awesome possibilities that are everywhere around us. For example, take our collaborative regional Healthy Moms program, which we launched in 2018 under the able leadership of Barbara Durkin at Lackawanna County Department of Drug and Alcohol Programming. Numerous partnering organizations gathered in this effort in direct response to the widely publicized reality statistics of the opioid epidemic. This innovative multi-county, multi-organization program is successfully helping pregnant women and new mothers overcome opioid and often polysubstance addiction to embrace a life in recovery, and it's clearly reducing the incidence and severity of neonatal abstinence syndrome in their babies. The program is a welcome bridge to our public health efforts to eliminate hepatitis C and HIV in our regional community. It's a program delivering positive impact for 2 generations of patients, their families, and our larger community right here in northeastern Pennsylvania. The Institute is helping us tell the inspirational Healthy Moms program story through its multidimensional outcomes evaluation work for the real-world data that details its positive impact on patients and families and our community as we collectively continue to struggle and battle the opioid crisis. I am proud to say that 326 mothers and 173 babies have participated to date in the program over an 8-county region, with 137 mothers remaining meaningfully engaged. 20% of those engaged moms are from our rural communities. We appreciate the Institute's contributions to provide validation of our Healthy Moms program as a prime example of value-based investment of limited resources to make a real difference in a very complex societal issue. Patient testimonials and measured outcomes tell the real story. Most recently, Maria Cocharnal, our Director of Addiction Services and our Healthy Moms program, reported a noticeable decrease in the incidence of neonatal abstinence syndrome among babies born to mothers engaged. Breastfeeding rates amongst those mothers who delivered at Moses Taylor Hospital in Lackawanna County is also on the rise. Such trends and positive correlations inspire great hope to continue and iteratively enhance and further inspire our collective, impactful work. Thanks to the Institute's good work, policymakers and community leaders can similarly appreciate the impact that their work has had through their investments in particular projects, or it can pinpoint where adjustments or additional resource investments should be made. Each organization here today should celebrate how your efforts and economic impact has influenced the community. Whether it be through job creation, wage taxes, workforce retention, job development, or community revitalization, we all collectively play a large role in fueling our regional economy. We are grateful for the Institute's annual economic impact completed for the Wright Centers, and we recommend that you consider the Institute's services to quantify, spotlight, share, and celebrate your impact. The Wright Centers for Community Health and Graduate Medical Education proudly invest in the Indicators Forum because of our admiration for the Institute's inspiring leadership by Terry, Andrew, and their team on addressing our regional economic, workforce, and social issues, and for its ongoing advocacy for universally beneficial, lasting, life-enhancing improvements across our region. As a proud academic partner of the Institute, we hold tremendous respect for its work, as well as for its commitment and the cumulative effort of all of the incredible academic partners and vested stakeholders gathered here today. It's exciting to examine our shared metrics from economics and health to housing, workforce retention and development, civic engagement, and our environment, and to celebrate our identity, shared purpose, and our successes. Surely the indicators information shared today will help us identify emerging possibilities and opportunities. It can give us the common ground from which to form unprecedented alignment and collaboration across sectors and across organizations to move our region towards a preferred future of greater prosperity. Our like-minded commitment to the continuous improvement in the health and welfare of northeastern Pennsylvania is a catalytic force for good, and I'm honored to stand shoulder to shoulder with you, Terry, and with every vested stakeholder in this noble pursuit. The collaborative sharing by each of today's presenters will paint the full picture that we need to force multiply our efforts and bring about much needed change for the better, prosperity, health, and happiness in northeastern Pennsylvania. Our joint accountability and collaboration will improve our region for families, our academic institutions, and our businesses. Understanding northeastern Pennsylvania's multifaceted issues from the perspectives of many different sectors is where the reliable, high-integrity work of the Institute becomes crucial. The multidimensional health needs assessment crafted by the Institute, for example, has been of great use to the Wright Center in developing our continuously improving, community-responsive, primary health care and workforce development services, such as our psychiatry and geriatrics centers of excellence and training programs, as well as our overarching integration of lifestyle medicine. Similarly, the Institute's new interactive data dashboard is a great tool available to the public and the stakeholders for taking deep dives into regional issues such as technology and innovation, public safety, infrastructure, education, and social services. We believe this data dashboard can also be an awesome, publicly accessible platform for a community-driven, inclusive regional health data repository that can illuminate health and both healthcare and social service utilization and outcomes in our region. Wide-scale visibility of these outcomes can inspire wide-scale health information technology interoperability and usability across healthcare delivery systems that otherwise may be competing. Our society and our collective psyche have taken some big hits recently, Between the shock of the global COVID-19 pandemic, a relentless opioid crisis, the far-ranging reverberations of a rapid economic inflation, and now an absolutely tragic European conflict. To best serve our region and its people in the months and years ahead, our focused attention and collective action on our health and economic indicators will be crucial. On behalf of the Wright Centers, our more than 600 employees, the patients and learners we serve, and our governing boards, I can enthusiastically say that we look forward to rolling up our sleeves and working alongside all of you to improve the health and overall welfare of our regional community in measurable ways we can all be proud of. Congratulations, Terry and staff, on what promises to be an amazing 2022 Indicators event. And thanks everyone for your participation in the Indicators Forum and for your ongoing commitment to the health and welfare of northeastern Pennsylvania and its tremendous community asset of the Institute for Public Policy and Economic Development.